Good morning students. Today we are going to discuss the tibia bone. This is the medial and larger bone of the leg. So it is placed vertically in the body. To determine the side, we have to keep in mind three important points. What are those? The upper end of this bone is expanded. Lower end is smaller than the upper end. But from the lower end, one projection is projecting downward. This projection is given the name that is medial malleolus. Third point is that on the anterior part of the upper end, there is a tuberosity which is known as the tibial tuberosity. So keeping in mind these points, that is upper expanded portion facing upwards, tibial tuberosity anteriorly, and this projection, that is medial malleolus, is facing medially. So this is the bone of which side? This is the bone of left side. Now coming to the upper end. Now this upper end is made up of condyles. So these condyles overhang the posterior surface. You can see. So they just overhang the posterior surface. Now this upper end, it includes the two condyles, that is medial condyle, lateral condyle, intercondylar region, and the tibial tuberosity. Now coming to the condyles. So the medial condyle is oval in shape, you can see. It has flat peripheral surface and concave central surface. This peripheral surface is going to articulate with the medial meniscus, and this concave area is going to articulate with the medial femoral condyle. Now this lateral portion, lateral condyle is circular in shape. Same here, that is a peripheral portion is flat, going to articulate with the lateral meniscus, and central portion is concave, which is going to articulate with the lateral condyle of femur. Now, if we see on the medial condyle posteriorly, there is a groove. This is a groove for muscle, that is semimembranosus muscle. And on the lateral condyle, on the anterior side, you can see a facet which is for the iliotibial tract. Going more posteriorly and inferiorly, there is a facet which is known as the fibular facet. This fibular facet is for the articulation of the fibula. Now, just behind this fibular facet, there is a groove that is spheromedial to this. There is a groove, and this groove is for the tendon of popliteus. So this is the description of condyles. Now coming to the intercondylar region. Intercondylar regions mean the area between the two condyles. Now this intercondylar region has an elevation in the center which is known as the intercondylar eminence. Now in front of this eminence, this is the anterior portion, and behind this, this is the posterior portion. Now, if we see the intercondylar eminence, it is flanked by the two tubercles, that is medial intercondylar tubercle and lateral intercondylar tubercle. Now, what are the important ligaments which are related in this region from anterior to posterior side? First, we will discuss the anterior part, that is in front of intercondylar eminence. There is the anterior horn of medial meniscus. Then comes the anterior cruciate ligament. Here the anterior cruciate ligament is attached. Then there is the anterior horn of lateral meniscus. So you can just remember the things by mnemonic, that medical college Lahore, that is anterior horn of medial meniscus. Then comes anterior cruciate ligament. Then comes the anterior horn of lateral meniscus. Now coming posterior to this intercondylar eminence. Here this is the facet for the posterior horn of lateral meniscus, posterior horn of medial meniscus, and this posterior most is the posterior cruciate ligament. So Lahore Medical College. So this is the mnemonic to remember these 6 ligaments from anterior to posterior side. That is anterior horn of medial meniscus, I repeat. Then there is anterior cruciate ligament, anterior horn of lateral meniscus, Medical College Lahore. Then comes a Lahore Medical College, that is posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligament. So this is the description of the intercondylar area. Now come to the tibial tuberosity. Now this tibial tuberosity has the smooth facet for the attachment of ligamentum patelli and lower rough portion, which is basically subcutaneous, and it is related with the infrapatellar bursa. So the line of demarcation between this, that is between smooth and rough area, is the basically line through which the epiphyseal line it passes. Now coming to the shaft portion. Shaft has 3 borders and 3 surfaces. What are those borders? One is anterior border, which is starting just below the tibial tuberosity, going downward and reaching up to the anterior margin of the medial malleolus. So this is the anterior border, which is sinuously curved, you can see. To this anterior border, the deep fascia of the leg is related in the upper part, and in the lower part, it is related to the superior extensor retinaculum. Then coming to the medial border. Now this medial border, it is basically starting from the medial condyle, coming downward and reaching up to the posterior margin of the medial malleolus. So this is the medial border. Then comes the lateral border, which is starting in front of the fibular facet. You can see running downward, going downward and ending up to the upper portion of this rough area, triangular rough area. So this is the lateral border. Now correspondingly, between the anterior border and medial border, this is the medial surface. Between the anterior border and lateral border, this is the lateral surface. And posteriorly, this is the posterior surface between the lateral border and medial border. Now, if we see this posterior surface, there is an oblique line you can see, which is starting from this lateral condyle, going downward and is going to join the medial border at the junctional portion of upper 1/3 and lower 1/3. So this oblique line is given the name soleal line. So it divides the posterior surface into two parts, upper triangular area and a lower vertical portion. This vertical portion is further divided by a vertical ridge, you can see, into two portions, that is the medial and lateral. So medial part and lateral part is basically divided by a vertical ridge on which the nutrient foramen is present. You can see here. So this posterior surface, initially it is divided into two parts, upper triangular and lower portion. Lower portion is further divided by a vertical ridge into the medial and lateral part. Now coming to the attachment on the shaft. Now this medial surface is basically subcutaneous. In the upper portion, it is receiving the tendons of three muscles, that is sartorius, gracilis and semitendinosus, from anterior to posterior side. So sartorius, gracilis and semitendinosus, and rest of the portion of this medial surface is subcutaneous. Now this anterior border is known as the shin of the tibia. Coming to the lateral surface, upper 2/3 portion of the lateral surface is giving origin to the tibialis anterior muscle. Coming to the posterior surface, above this soleal line, this triangular area is receiving the insertion of the popliteus, and in the lower part, that is medial portion, is giving origin to the flexor digitorum longus, and the lateral is giving origin to the tibialis posterior. So these are the important muscles which are related in this region. Now coming to the attachment of this soleal line. To the soleal line, what are the structures attached? It is receiving the fibers of the popliteus, then it is giving attachment to the fascia covering the popliteus, then fascia covering the soleus, then superficial transverse facial septum. And it is basically the medial end of the tendinous soleal arch is related to the upper tubercle of this. You can see a tubercle in the upper portion of this soleal line. To this, the medial end of the tendinous soleal arch is attached. So these are the attachment on the soleal line. So this is very important viva question. Now coming to the lower end. Now this lower end, you can see it has 5 surfaces and one process. What are those? Anterior surface, posterior surface, medial surface, lateral surface, inferior surface and medial malleolus is the process. Now this anterior surface is smooth above and rough below. Now in this rough portion, the important tendons which are related to this rough portion are from medial to lateral side. This is tibialis anterior tendon. Then comes the extensor hallucis longus. Then comes the anterior tibial artery is related to this. Then nerve, that is deep peroneal nerve, is related. Then comes the extensor digitorum longus and peroneus tertius. So easy way to remember the thing is the Himalayas are not dry places. So the T is related to tibialis anterior, Himalayas is extensor hallucis longus, R, that is artery, anterior tibial artery, not nerve, that is deep peroneal nerve, deep peroneal nerve. Then comes the extensor digitorum longus, dry places, and places is the peroneus tertius. So this mnemonic is to remember the things from medial to lateral side, what are the different tendons related to it. Now coming to the posterior side. From medial to lateral side, the different tendons which are related are tibialis posterior tendon. Then comes the flexor digitorum longus. Flexor digitorum is related. Then comes the artery, that is posterior tibial artery. Then comes the nerve, that is tibial nerve. Then comes the flexor hallucis longus. So these are the tendons, vessels and nerves which are related to the posterior surface of this. Now coming to this lateral surface of the lower end, Lower end has a triangular rough area over here, which is giving attachment to the interosseous tibiofibular ligament, and lower part of this is giving attachment to the articular cartilage. So this is going to articulate with the fibula. So this is known as the fibular notch. Now coming to this inferior surface. Inferior surface is going to articulate with the trochlea, superior articular surface of the talus, that is trochlea of the talus. So with this articulation is extending up to this portion, that is up to the medial malleolus. Now coming to the medial surface. The medial surface of this is subcutaneous and is continuing with the medial surface of the medial malleolus. Now this is the medial malleolus. This medial malleolus, you can see, this is a projection which is projecting beyond the lower end of the bone, and this has a lower portion. This is known as the inferior border, which is grooved posteriorly. You can see a groove over here, and this groove is for the tendon of tibialis posterior. To the whole length of this lower end of the medial malleolus is which important ligament is related to it? That is the deltoid ligament of the ankle joint. And to the anterior margin, anterior ligament of the ankle joint is related to it. So this is regarding the lower end. Now coming to the ossification portion. Now ossification is shaft is arising from one primary and two secondary center. Primary center is for the shaft which appear by the age of, that is, 7th week of intrauterine life. For the upper end, the center appear just before birth, and that fuses with the shaft by the age of 16 to 18 years. For the lower end, the center appear during first year of life, and for the malleolus, it appears by the age of 7 years. This medial malleolus is going to fuse with the lower end first, then it is going to fuse with the shaft by the age of 15 to 17 years. So this is all about the tibia. So that is side determination, the different important attachments to this tibia bone, and what is the ossification of this bone. So thank you very much. If you like my video, kindly share it and subscribe it. Thank you very much.